my name is Fazila Aswa and I'm the Service Manager for the Kirklees area for Royal Voluntary Service. Royal Voluntary Service are a national charity, and what we do is we work quite hard to combat loneliness and isolation that affects older people. Our service in Kirklees does exactly that. We have a series of activity groups that are accessible for older people, and they're built around their needs, and we try and tailor them to what they want from their group. So each area could be quite different in Kirklees to another area. We also have a Kirklees-wide befriending service, so that's where volunteers go in and support an older person in their home, and it could be practical support like shopping or going to appointments, or it could be simply just sitting and having a conversation with people. So that's the two main strands that we deliver in Kirklees.
Well, I come for the company and for all the games and that we play, and the tea and coffee, and sometimes a nice little buffet. So it's all worth coming to. It gets you out, which I don't like stopping in. I prefer to be going out, and keeps you moving. Like I'm getting to the age now, my joints are giving way, and it helps me a lot doing the exercises and coming down and playing the games and everything.
One of the things that we sort of pride ourselves on is the health and well-being of our volunteers and our members, and we decided to go for Quality for Health because it was a bit of a sort of fact check for us to make sure that actually were we doing those and meeting those, but actually what I wanted to do was also identify gaps. So we knew that there were certain things that were doing very well, but sometimes when you're in the project you almost sort of can't helicopter up and see yourself from other people. So this was an opportunity for us to be looked at from the outside, and actually it was really helpful because the Quality for Health has certain areas that you have to meet and certain criteria that you have to look at, and what it did was allow us to sort of do an internal assessment of ourselves. There were bits where we thought actually we can do better at this, or we can introduce this to make it better. One of the things that we did was we sort of reviewed our induction for volunteers. One of the other things that we did was introducing healthy welcome packs for our members. So we already had a welcome pack, but it was quite thin, and what we did was we reviewed that and said actually we could do, like we had a sheet in it around falls prevention, we had a sheet around you know, what other services that could help them. So even just little things like that can make a big difference. When you sign up for Quality for Health, you're sort of almost given like a supporting officer, and ours was Dorothea. And what was really helpful for us was she coordinated quite a few meetings for other organisations that had also signed up for Quality for Health, and we had quite regular meetings and shared sort of, well, we found this and we did this, or you know, we found that if we did this helped us to do this. So it was quite good to share that sort of experience of what other organisations that were doing and we might not have thought of. And the other thing that was really helpful was the free training courses that VAC sort of offered. So they were really useful because our volunteers and staff were able to access those. Equality and diversity was an area that we were looking at for our delivery in Kirklees, and one of the things that we were conscious of was that our membership didn't quite reflect the diversity of the Kirklees population. So we were able to sort of work with Dorothea to, okay, how can we sort of work to sort of combat that? And although we know that you can't force somebody to come somewhere, you know, we could, so we signed up with the BAME network, we worked with other organisations that were thinking, so we were able to then start thinking about, like, constructively what can we do to sort of engage those communities and harder to do each group. So